Check out this blood pressure question. Blood pressure is a concept that you really need to understand really well for the board exam. So here's a question that looks at this. Mr. Claus, 78 years old, presents for his first office visit. Upon taking vitals, you notice his right arm's BP is 130 over 87 millimeters of mercury. How should you proceed? So looking at all the options here, knowing that the BP is 130 over 87, what do you think? If you said B, you would be correct. You can proceed. So with this range, you can proceed with dental treatment, assess risk factors, so see if your clients have any other comorbidities, or maybe they have other issues of their body, so if they have any heart issues, diabetes, they're a smoker, that sort of thing. Just assess if there's any risk factors, and then refer for medical consultations. So check with their doctor in the sense that you could write down the blood pressure readings for them so that they can go and see their doctor and follow up with their doctor after, but you could proceed with the dental treatment. You could do everything. You can debride, you could do invasive procedures. So with 130 over 87, you're allowed to move on as long as you document their blood pressure and you tell them to go see a doctor. Ideally, if you guys remember, when you have elevated BP, you would wait 5 minutes and then take a BP again, preferably in the other arm. So if this person, we did it on their right arm, this was their blood pressure, 130 over 87. Now you would do it 5 minutes later on the left arm, so opposite arm. Here is a chart from Darby, and I thought let's take a few seconds or a few minutes really to dissect this table. So this is from Darby, the most recent edition, and anything that is below, so 120 or over 80, so anything less than 120 and less than 80 is considered normal. And when someone has normal BP, routine dental treatment is permitted. Go ahead and debride and do anything invasive. There's nothing wrong with that. Same thing if it's elevated. So if it's like less than 130, so 120 to 129 or 80, less than 80, you can go ahead and proceed with dental treatment. No contraindications. But what happens when someone has stage 1 hypertension? So this is like the beginning of hypertension or high blood pressure, and the ranges are between 130 to 139 and 80 to 89. Now, what happens is in this, and this was the range that we saw in the test question, the 130 over 87 fell within this range. So here you can do everything. You can still debride, you can still probe, you can still explore subgingivally, but you want to make sure that you let the doctor know. So document the BP findings, give the BP readings to the client so that the client can take it to their doctor. Now watch what happens when someone has stage 2 hypertension. So this is when they have 140 or more systolic blood pressure, and then the bottom number diastolic would be 90 or higher. Now if this happens, they can, for the most part, go ahead and with routine dental treatment, but notice that there's an asterisk here. And this asterisk is there to show you that if they have a lot of risk factors, so if they have diabetes, if they have angina, if they're complaining of chest pain, if they've had a heart attack, then you want to be wary. You want to contact the doctor. In fact, most of us have a regulatory body where they have guidelines of what to do depending on their blood pressure ranges. So follow your regulatory body's guidelines. Now in the exam, if you were to get a question where the test the question asked you if it was 145 over 95, which falls under stage 2 hypertension, what do you do? So you could, for the most part, you could do, as long as there's no other risk factors, you could go ahead and proceed with treatment as long as you refer for consultation. So tell the doctor that it is elevated. The only time that you can't do it is when the BP is really high, like 180, more than 180, and more than 120. And if it is around this range, that's hypertensive crisis. We can absolutely not treat them. We can't see them until it comes back and as controlled. So again, when someone has stage 1 hypertension, feel free to proceed. Just document the blood pressure readings, and then also document it for the client so the client knows that they can take it to their doctor for a follow-up. If someone has stage 2 hypertension, here you need to do some critical thinking. If they don't have any other risk factors, you should be okay to proceed and do invasive procedures such as debridement, exploring, probing. Now, if someone has 180/120, hypertensive crisis, and this is when you cannot treat them under any circumstances. So in an exam, they likely will give you ranges like this, and they will ask you to follow these recommendations. All right, I hope that was helpful.